Hello everybody and welcome to the January meeting of the Health and Wellbeing Board. Christmas and New Year seems like a distant memory, but I'm still going to wish everybody an Happy New Year, so welcome today. Just a quick reminder that any observers, if there's an opportunity on the agenda to ask questions, they must relate to the agenda items themselves. Today's apologies for this meeting have been received from Richard Parker, Toby Lewis and Cynthia Ransom. We're not sure whether she's attending or not. Are there any other apologies for absence? No? Okay, thank you very much. There's no substitutes for the board today as well, so there's none been reported, so we're not aware of anybody who's coming that doesn't normally attend but is actually an active substitute. Okay, so we're not expecting a fire practice today, but if the alarm sounds, please leave the building by way of the fire exit through the doors at the rear of the chamber. When you have left the chamber, proceed down the stairway and exit through the emergency exit on the ground floor. If there is anybody with mobility issues, please wait in the refuge area at the top of the stairs where the emergency evacuation lift is located and use the intercom situated to the left-hand side of the lift doors to call for assistance. The designated assembly point is in the public square in front of CAST beyond the fountain. I would like to inform any members of the public and press that today's meeting will be audio and visually recorded, and by entering the council chamber you accept that you will be recorded and your images retained and broadcast by the council on its website and on YouTube. If anyone intends to record or film any part of today's meeting, please ensure that this does not disturb the conduct of the meeting and you only focus on recording these people participating. We'll now move on to number 2, which is Chair's announcement. I've got no announcements to make today. However, I think it'd be useful if we did some introductions, if that's okay, just for sort of like 5 minutes. So I'm going to start from the left-hand side and then move over to the right. And if we could sort of like start on the higher row, those people that are escalated, and then we'll move on to the middle row and then obviously the bottom row. So Vanessa, do you want to kick it off?
Morning, Vanessa Powell, Highland Public Health Lead. Hi, I'm Bethany Hayes. I'm a public health degree apprentice, shadowing Vanessa.
Morning everybody, Lee Galtz, Assistant Director in Children's Services. Chair, I came in just at the you noting apologies, so just note Rihanna Nelson's apologies. We're inundated with Ofsted at the moment.
Morning, Claire Hewitt, PA to Rachel Leslie.
Thank you, and now we'll move on to the middle row.
Good morning, everybody. I'm Richard Gettins, and I'm an embedded researcher at Doncaster Health Determinants Research Collaboration Team.
Morning, Simon Azade Forge, Public Health Theme Lead at Doncaster Council.
Morning, everybody. Caroline Temperton, Public Health Lead for Healthy Places at the Council.
Good morning, everyone. My name is Ruth Bruce. I'm the Doncaster Place Development Lead.
Morning, everyone. I'm Tony Ullman, Chief Funding and Information Officer for Doncaster Culture and Leisure Trust.
Thank you, and now we'll move on to the lower row.
Claire Henry, Public Health Principal, City of Doncaster Council.
Hi, Ramona Shafiq, Public Health Degree Apprentice.
Victor Joseph, Consultant in Public Health, City of Doncaster Council.
Good morning, I'm Rachel Leslie, Director of Public Health at City of Doncaster Council.
Marius, do you want to kick us off on the top row?
Good morning, Marius Taba. I'm community link worker with focus on Gypsy Roma and travelers, but I'm working on under the supervision of Amanda Espey, which is the Health Inequalities Lead for Doncaster. So I have here 2 hats. Thank you.
Morning all, Nabil Al-Sindi, I'm a GP and I'm Place Medical Director for Doncaster at NHS South Yorkshire.
Good morning everyone, James Woods, Chief Exec at Citizens of West Doncaster.
Hi, good morning, I'm Van Jel, I'm Chief Operating Officer of Healthwatch.
Morning everyone, I'm Chris Margrave, I'm Chief Exec at Ledger Homes.
Hi, Laura Sherburn, Chief Exec of Primary Care Doncaster.
Phil Holmes, Director of Adults Wellbeing and Culture in the Council.
And to the lower row, Sarah.
Cabinet Member for Adult Social Care, Sarah Smith.
Hi, I'm Anthony Fitzgerald. I'm Executive Director for NHS South Yorkshire and I'm the Vice Chair of the Health and Wellbeing Board.
Glynis, I've just noticed we did miss you. Are you not going to introduce yourself?
Yeah. Good morning, everyone. Glynis Smith, Hatfield Ward Councillor.
Thank you very much. Okay, moving on to item 3, exclusion of the press and public. There are no items on today's agenda where the press and public are to be excluded. Thank you. And then we'll now move on to item 4, which is public questions. We have a 15-minute maximum time period for this. Okay, so this is a standing item on the board agenda aimed at providing an opportunity for members of the public to ask a question or to make a statement. Please note that questions or statements should relate to an item of business on the agendas for today's meeting. Are there any elected members or members of the public attending today's meeting who would like to put a question to the board? Hello, Mr. Brown. Do you want to make a statement or do you want to raise a question? Do you want to come forward to a mic?
So let me take the shirt off. So is it? Oh God. Right. Yeah, I'm ready now.
Off you go.
Okay. God, it's nerve-wracking in front of so many distinguished people. But anyway, I'm going to keep it sweet. I must admit, my name's Tim Brown, born and bred in Doncaster, to a miner who's no longer here. So born in poverty, place called Scorethorpe. Tried really hard to raise our children to the best of our ability and to navigate the deep-rooted and systemic racism that takes place in Doncaster. That was initially corroborated by Professor Gus John, who was commissioned by the council approximately 20 years ago. And you might say, oh, well, that was 20 years ago. And I would like to say that things have improved, things have changed, but sadly it hasn't. You know, so if you can imagine not only being poor, but being black and having to raise your children where there is a lack of aspiration, hope. And that's the lived experience that I come here today. And, you know, there's enough people in this room who have come across me over the last 25 years. And if they want to put their hand up to say what I'm saying is not true, then please be free to do so. Because what I'm saying is the truth. And I'm kind of lucky in the sense that I'm strong enough to have navigated, to the best of our ability, the racism. So when my son tried to find employment with Doncaster Council, he had aspirations of being, you know, working in finance or what have you, as an apprentice, and they come back to him and say, well, you can't apply because you've got no experience as working for the council. This is an entry-level job. This is the situation what our children are facing, and they're having to leave Doncaster as a result because of the lack of opportunities. Yeah? And that, why is it? Why would an entry-level job require experience for Doncaster Council? When Doncaster Council, we know, does not provide many opportunities. If you look at the workforce profile, you'll see lots of black minority ethnic people at the lower banding. But when I've asked Damien Allen how many of his senior managers or chief officers are from a non-white background, the answer is none, right? And you've got to say, well, this was something that we raised with Gus John, or Gus John highlighted this 20 years ago. Why hasn't anything changed? Yeah? Now, delighted, my son overcome the kind of indignity of not even being allowed to apply for an entry-level job. The same guy is an investment banker with access to the City of London. You know, in Doncaster, why is it and how is it that we allow our talented youngsters? So it's not just about my child. There's many children who are forced out of Doncaster, and there's people in this room who just allow that to happen. And we've got to ask the question, why is it? You know, why is it? You know, or, you know, now don't get me wrong, when he was looking for a job with the Doncaster Council, I think he was about 18 or what have you, so just doing his A-levels or whatever it is, but why is it that nobody in Doncaster could spot potential talent or what have you? You know, because I'm not a banker or what have you, and, you know, I'm not just blowing his trumpet, but it, you know, it would appear that the guy must have had talent, and there's talent in and around Doncaster from poor backgrounds that had just been kind of overlooked, yeah? And that at the council meeting, 19th of September, there was 19th of September 2024, there was an acknowledgement of systemic racism, right? And again, so it's documented, it's on camera or what have you. And one of the reasons why I'm here today is, what is the response to that acknowledgement of systemic racism, right? And especially when Dr. Joseph is going to present, I'll get the name of the report, Action Plan for Improving the Health of Minority Communities in Doncaster, right? Now, I'm black, I'm active, you know, my family, we've contributed to our NHS over 200 years, and yet we can't meaningfully be engaged in this piece of work. Yeah? So part of the question, Chair, that I'm asking this Health and Wellbeing Board, and in relation to this Health and Wellbeing, in relation to the BME or the Action Plan for Improving the Health of Minority Communities in Doncaster, is I'm a minority, I've looked at the action plan, it doesn't speak to me, my family, or the people who I associate with. We've never been allowed properly to meaningfully engage in this process, right? And that's not right. That's not right, right? We know, I know, people in this room know that racism is a public health issue, right? You know, if people don't, again, if people think, oh God, he's making it up or what have you, I can show you the evidence. But you guys know this, and yet nothing's been done about it. The document in front of you, right? From when this BME Health Needs Assessment started, I was the one who initiated it. Doncaster Council never had one. I think it must be 15 years old from when it started. 10 years? Or 15, sorry. Right, okay, sorry, you were nodding your head, so right. Whatever, right, so the point what I'm asking politely, and I hope you don't think, oh God, he's an angry black guy or what have you, because that's not the case, right? That is not the case, right? I do care, you know, I do care about my family, I do care about my community, yeah? That's why I'm here. I've got hundreds of odd things to do or what have you, but I'm here to make the point, right? So if we say that this BME Health Needs Assessment started 10 years ago, say, right? I don't see anything in here that tells me what progress has been made in those 10 years for the communities that this report is supposed to speak to. That's number one. Number two, it's not clear to me that those of us who are interested in this BME Health Needs Assessment Action Plan, what is our opportunities to engage in it, right? I've been excluded, systematically excluded, right? Maybe because I articulate my concerns, right? That can only be the reason, right? We've got family members. I used to share a room with Dr. Joseph at Barnsley PCT about 20 years ago, right? So I've got a little bit of a background, not to people in this room, but, you know, we've worked in the NHS outside of Doncaster, but yet we can't have a meaningful comment. The only comment we can have is to tick box and say, this is okay. Well, hopefully, right, I've got to make a stand in the sense of, I don't think that this is okay, right? I want some clarity in terms of, right, what progress has been made from when this started to where we are now, because it's not reflected in here. And in relation to the composition of BME groups in Doncaster, so I'm part of the Black African Caribbean. A colleague over there talked about representing the Roma Gypsies. So we've all got different health needs. It's not clear to me what are those different needs. But certainly from a Black African Caribbean perspective, I would just like a little bit of clarity, a little bit of understanding. What are the key health needs for the people who look like me? And how we can work with partners in this room to improve our health and well-being. Because as I've said before, right, we know that racism, and as I say, it was acknowledged, not only Gus John, but 19th of September 2024, there's an acknowledgement of systemic racism, right, in Doncaster. I don't know the context and all that kind of stuff, but given that there's that acknowledgement, what practical actions through this report, public health or the council and its partners, what are they doing to address that? Because I've asked that question and I've been fobbed off simply because of the colour of my skin, right? And it's not right. It can't be right.
Okay, thanks, Mr. Brown. I'm just conscious of time, that's all. I think you made some very pertinent points there, and I think there's some questions that obviously need answering. What I'm going to do at this point is defer to my Director of Public Health, Rachel Leslie, to sort of give you a response, but also to say that obviously item 10, that's dealing with those issues that you've quite rightly, you know, obviously brought to the board this morning. So I'll pass over to Rachel to give you some sort of response, but also encourage you, if you want, to stop to item 10, which I think would be really useful.
Sorry, Chair. I might have to dash because I've got a meeting, unfortunately. I'll try to do
That's fine, Mr. Brown. All I'm going to say to you is obviously it's recorded, so if you want to sort of like look at the recording afterwards, there'd be no problem with that whatsoever. Okay. Rachel, do you want to come back on that? Mr. Brown, can you just flick your microphone off?
Sorry.
All right, no problem.
So thanks for your contributions. There's a couple of elements that you've described that I want to respond to. So around the process for getting to the action plan for people from minority ethnic backgrounds, I'll talk through that. The meat of that item will be under the scheduled agenda item, and I'm sorry you can't stay for that, but do watch it. I'll attempt to give a abridged version to help you with that. I also just wanted the opportunity to describe work opportunities. You mentioned apprenticeships as well. So particularly from a public health perspective, and directors of public health have a duty to the whole population, and particularly to inclusion health groups, whether that be people from black and minority ethnic backgrounds, whether it be sex workers, people with a drug or alcohol addiction, people with a disability. So directors of public health have a duty to their whole population, and particularly to those that have a different either access, experience or outcome in their health and well-being. So just around opportunities for young people, not by invite but by happenstance, we've got 2 of our 3 public health apprentices, and we've had a number of apprentices as well. And at a previous, probably about 1 year ago, we had our Shaping Staying for young apprentices join us as well. So we recognise the need to build our public health team and how we support the wider council and Team Doncaster, pulling from our population, and we've brought our level 6 of our degree level apprentices in to reflect. And I don't want to introduce you or wave at both of you here, but we've got Romana and Bethany that have joined us today, and we've had young apprentices as well. So we do make, and we have made that improvement in opening our opportunities for local Doncaster people to be part of that future public health workforce. Around the action plan, again, by happenstance rather than by invite, we've got a number of people that were involved in developing that action plan, and it has been a journey. So you asked us about health needs assessments for minority ethnic people. So we've got now the second one in Doncaster. Again, Victor in the item later will talk through this journey. But we've had a health needs assessment. We refreshed that through COVID, particularly reflecting on the COVID experience of people from Black and minority ethnic background. And then we redid and republished a new health needs assessment, which was in 2023, and that was brought to Health and Wellbeing Board. So your questions that you've asked about different experiences of people from different ethnic groups are explained in that health needs assessment. The health needs assessment that we undertook used a standard accepted methodology for health needs assessment. There are always limitations in health needs assessments, and they're always described in the document as well. It might be access to data, and actually that was one of the 4 recommendations from the needs assessment, which reflected on that national recommendation as well about recording of health data, particularly for people from an ethnic minority background. So in our BME needs assessment, you will see as well there's a sentence about limitations. Moving on to the action plan, so that was one of the recommendations from Health and Wellbeing Board to build an action plan. That's been built through and with the Minority Partnership Board that has had input across various Doncaster communities. It's then been to various groups to grow and develop that action plan as well, including last year's Team Doncaster Summit as well. So that co-produced action plan has been co-produced with Team Doncaster and with communities as well. And I think we've got some people that have joined us today who've had a strong hand in the development of that action plan. It would be great if you could stay for Victor's item, but I understand that you're not able to. But would suggest for today then that you watch back the presentation from today, and if you still feel that some of your answers are not given through that presentation, through that section, then again we're happy through the processes to give you some more information too.
Sorry, yeah, I'll have to go, but I think the key point which you've not really answered is we're looking at progress, so it's not clear what progress has been made. Yes, there's another action plan, but what happened to the previous action plans or what have you? And then secondly, it's around going forward. How do people who look like me, who are interested, how can we meaningfully engage? Because we have got the lived experience. We don't know it all, right? But, you know, we want to be part of it because, as I say, I know that there are other young people who are even more talented than my son. So if my son can become an investment banker, there's tens of other children from deprived backgrounds who can, but we need to remove the blockages. That's it. Thank you.
So, because you're not able to stay, Victor's offered to give you a quick précis of that summary from the achievements from last time. Thanks, Victor. I hope that's okay, Chair.
Yeah, thank you. What we've done was we first did the health need assessment in 2018, and as part of that, we updated the Health and Wellbeing Board annually, giving progress, challenges, and then the action plan for the following year. So that's what we have been doing. If you are okay, we can send you that. It's quite evidence-based, and it was objective to kind of outline what we have achieved, particularly during the COVID years. We were meeting every week to ensure that the guidance around COVID and so forth is communicated to minority groups. We did videos. We worked closely with our NHS partners in order to communicate that message. So a lot of work has gone into that. Even before that, we evidence our work, working closely with the various groups, in order to ensure that what we were doing is communicated back to communities. We created the BME steering group with representation from community groups as well. The purpose was so that the implementation is fed back to community and vice versa. And I do remember Tim was part of that minority partnership board. We eventually formalized it as a board and asked members to sign up to the code of conduct, which is essentially very simple: honesty, honesty, and being respectful to each other. But I think, from my recollection, Tim, you've opted to not to sign it and not to be a member. So the door is still open. We still welcome members from the group for you to engage with that. So that process still will be ongoing. The name of minority partnership board, minority, it's meant to be inclusive. It's the group that agreed to that terminology, to be inclusive. You will know that the word BME or BAME, in various parts of the countries, it is different. We consider all those. So when we came to the terminology minority, it might seem not to include African Caribbean, but it's inclusive of the minority groups in Doncaster. And I think also you talk about racism. We do acknowledge the challenge of racism exists there. In fact, actually within Doncaster, Team Doncaster, we've been engaging in effort to address racism. There is a kind of working group in place to work towards that. Both locally and regionally have been championing some of those aspects. So it's not that we are not acknowledging there's a problem. We are actively working towards finding solution. I think those are the few remarks I can give. Happy to send you progress report.
Yeah, thank you for that, Victor. Just before we move on to sort of like item 5, I just want to sort of like also welcome your comments basically that you made in terms of recruitment and selection, because I think although it disproportionately affects ethnic minorities in terms of that process, I think that it's a wider issue as well, particularly around class-based acknowledgement that obviously people from our most deprived communities, which are often sort of like ethnic minority individuals, struggle with the application process and being able to fill it in. And it's incumbent on all of us really to almost review the process that we've got in place with our recruitment and selection, because I think that there's work to be done on that. And I've said this a few times, and it's not just local authority, it's probably third sector and it's NHS as well. It's extremely difficult for entry-level jobs and people applying for entry-level jobs to go through that process. And it's daunting to people from an ethnic minority and also, I would say, people that live in our most deprived communities. But I thank you for your comments and I thank you for your question, Mr. Brown. All I can say to you is please, obviously, you know it's being visually recorded. You can obviously refer back to it when you get home, and I hope you have a good day. Okay, thank you. So we'll now move on to item 5, which is around declarations of interest. Does anybody have any disclosure, any pecuniary interest or other interest to declare in relation to the business on today's agenda? If so, declare it now and complete a declaration form available from Christine Rothwell in the governance section. No? Okay, thank you. Item 6, minutes of the Health and Wellbeing Board held on the 7th of November 2024. The minutes of the board last meetings are attached as agenda item 6. The board is asked to consider and approve these as a true record. Can we agree that the minutes are a true and accurate record? It's a long time ago, but anybody was here, can we approve them? Is that okay? Is that agreed? Approved and agreed, right, thank you very much. Right, I will now move on to item number 7. Rachel Leslie, she's going to give us sort of like a bit of a lowdown in terms of sort of like healthy places to live and grow. And we're asked to look at some recommendations after the presentation. Over to you, Rachel. Thank you.
Thank you, Chair. So this report represents our final report back to Health and Wellbeing Board after our deep dive development sessions around the 3 different priority areas. So this one's around our area of focus, creating healthy places to live, grow and play. Most people in the room today will remember the session that we had on this. We considered evidence, experience, testimonies, and reviewed some of the good work that was already happening in Doncaster to create and improve healthy places. So through the session as well, hopefully you'll recognise the format of this document similar to last time. This one, in advance of the session, we've nominated our sponsors, our 3 sponsors. So they are myself, Dan Swain and James Woods. And as the document followed before, relates this back to the overall aim of the health and wellbeing strategy, sets the scene with some of the data that we've collected and considered as a health and wellbeing board that made this a priority. We've shared our key findings. Those have come about through Fairness and Wellbeing Commission, through the discussions we've had and through the data and the evidence that we've been presented as a board. So summarise those in a key findings section. We've then got an area that we had for our shared views and commitments from the board. So the group sessions that we had last time, really trying to refine the focus for the Health and Wellbeing Board for where it can make a difference. So just to summarise, we've got areas around commercial determinants of health. We've got areas around further leveraging and improving planning systems around healthy communities. Further focus on people's employment status and particularly the fair pay elements, and then the Doncaster food plan in development as well. So that gives the Health and Wellbeing Board its focus for the next stages of the strategy. Short section on what next, and then a set of recommendations. So 4 kind of core main recommendations that link to those findings. So how we collaborate or how we move towards having stronger practices in place to combat harmful commercial practices. Next, around food environment and creating Doncaster or supporting Doncaster to have better access to better, more affordable, nutritious food. And then the last one around strategies to address health-related worklessness and in-work poverty. Last one around, again, further improving, enhancing what we're already doing and more around that placemaking and urban planning, including access to green spaces as well and the opportunities they have around physical activity and good mental wellbeing. As with the previous summary documents, again, we're asking that the Health and Wellbeing Board receive the periodic reports on these recommendations and to agree the 3 co-sponsors, which we've agreed in advance of today's session. So that's just a summary of the document, and I'll hand back to you, Chair, for the recommendations.
Thank you very much for that, Rachel. Just before I open it up to the rest of the board, the only comment that I want to make is although I note that we've obviously got those 3 sort of like sponsors, yourself, Dan, and thank you, James, for coming forward on this. Just in terms of recommendations, or on recommendations 4, building an established work, integrate health into urban planning and placemaking, increase accessibility to parks and green spaces, ensure amenity or easy access for all, and actively involve residents through initiatives like the Active Transport Accessibility Panel and Green Space Network. That's great. What tends to happen, though, if I'm perfectly honest, is there seems to be an over-concentration, particularly around planning, and these are potentially around planning new houses, new estates, and obviously new developments. My concern is our existing areas of deprivation. Many of them are old mining towns as well. We know that we've got a lot of pit villages in Doncaster that are struggling, and as places they are struggling as well. It's not just the fact that we need to look at new developments. It's around those existing areas as well. So I suppose from my perspective, I need to be able to see that real commitment to those. And we know which areas of deprivation we've got, and we know where they are, and it's about making sure that there is some change in those areas, and it's not just focused on new development.
So as one of the three named sponsors, I can spot James. I know that Dan's on his way as well. We will use the JSA particularly, I'm going to look behind me at Vanessa and Bethany, particularly the ward profiles, the health profiles that have been created for each of the wards as well, that describe the assets that are in places, so those green spaces that are there, but also other community assets as well. So we will use that element of the JSNA as sponsors to ensure that we're focusing work and focusing our attention to those communities that might just need it a little more. Just to note as well, just in summary rather than in detail, but the Thrive approaches that we'll be using and working together on as well will also help to ensure that our focus is on those communities that need more.
Excellent, thank you very much. I'll just open it up to the board. Does anybody want to make any comment, queries or raise a question? Sarah.
Thanks, Chair. This looks great. I just have a question, really, or a suggestion, maybe. It says here, agree for Health and Wellbeing Board to receive periodic reports on the progress of these recommendations, which absolutely. I was just wondering how, I know it kind of will be embedded through all different organisations of co-producing authentically, I hope, with the different groups of people that this affects. And just putting it out there, really, it'd be great to kind of take the Health and Wellbeing Board out into real life. And, you know, especially if we're reporting on this about people's lives, you know, give it a bit of life in the life, if you get me. Yeah.
I fully concur. We need to organise tours and day trips. Go on, Rachel. Sorry.
I'm giggling because that's precisely what, not the next item, but the item after will cover as well. So as part of our board development, we've looked at actually how do we work and how do we work best as a board. And when Claire does her section in the moment, I'm just checking, then it will cover that element as well. But yeah, we completely agree with you. Thanks.
Okay, any other comments or questions on that paper? No? Right. Thank you very much for that, Rachel. That's been really, really helpful. We'll now move on to item... Oh, yeah, sorry. Is everybody okay agreeing those recommendations that have been put forward, those 6? Yeah, everybody agreed? Right, thank you. Moving forward now on to item 8. This is a bit of a all-out review of the Health and Wellbeing December development session with Steve Benson. So I'll invite Rachel to address that again. Thank you.
Yeah, me again. Thanks, Chair. And I guess it is the next part of the story. So just starting with a thanks to those that attended the development session on the 3rd of December. It was the culmination of all the work that our Health and Wellbeing Board Group Secretariat have been doing with the LGA over the last, must have been about almost a year. So it gave us a chance to come together in the room around the work that we'd already been getting on with on renewing our health and wellbeing strategy, in deciding our 3 priority areas, and on developing our plans around those 3 priority areas. It gave us a chance to reflect on what we thought was good about the Health and Wellbeing Board overall, and also our experience of that development over the last year. I wanted to start with some of the strengths. So there's a section in the report about the strengths, and we were able to hear back from our LGA partner, who's been around to a number of different health and wellbeing boards, on his perception of Doncaster's Health and Wellbeing Board, and it felt really, really positive. The membership and the commitment across Team Doncaster partners isn't always observed or replicated in other areas. The membership that we've considered and reviewed and grown over the last year as well, and also the leadership elements as well. And Chair, that includes supporting you into your new Health and Wellbeing Board Chair role as well. I'm really pleased that you joined us on that day. The real focus and emphasis in the conclusion of the session was about bringing all of that good talk and all that good work that we've done over the last year into action, and the session that we've got at the end of today as well will help each of those sponsors around the priority areas to move those words into action. Let's see, so the other bit that we did as well that I just want to draw attention to in the report was, as well as looking at what we were proud of, where we needed to make improvements and some of the priorities for the 12 months ahead, was just that reflection back as well on whether our 3 areas of priority, what we've decided to focus on is sufficient, will make the impact that we need it to, and to review some of the progress so far. So just today, the aim is to present the report back for the wider Health and Wellbeing Board members and for those interested in the work and the business of the board. But we feel like we're in a really strong position for the 12 months ahead. Just 4.5 in the report document is those priorities for the next 12 months. So it's embedding these recommendations and priorities across our organisation. So we're here as a Health and Wellbeing Board as representatives of the organisations that we're in, and we've agreed through that each of us have got a responsibility to bring our organisations and our teams and our groups into making the priorities that we've decided work. The other one is around maintaining our relationships. There's some real positive reflections on the relationships that we've already got and those that have built over the previous 12 months and how we keep going with that over the next 12 months. And again, that collaborative approach, that co-production approach with our Doncaster residents as well. So thanks, Chair. Just a summary of our session from December.
Thanks very much, Rachel. Just from my own perspective, I thought the session was really good in terms of sort of like hammering down in the areas that we were focusing on. Just as a reminder, again, I'm sure everybody's aware, but sometimes I forget them, so I think it's useful to sort of like keep repeating them. It's, you know, the 3 areas that we're focusing on this year is obviously improving ageing, obviously sort of like creating a healthy place for people to live, and obviously tackling the health gap where women and families are concerned. I thought Steve handled the day really well. It was really useful in terms of actually looking at what we've done so far and where we wanted to be in terms of producing that bit of an action plan as well. So I'd like to formally thank Steve Bedser for coming up on the day and presenting that developmental session. And the fact that it was really useful to everybody who took part. I think it was anyway. So is there any other comments on that? I've got Anthony over there.
Yeah, I'd echo that. I thought it was a very helpful session. It was good to see that reflection on how we are compared to other health and wellbeing boards, but and that was good. That was good positive feedback, but it wasn't to rest on our laurels, was it? So I think there's a challenge to all of us here. Two things for me. For people who were there, we were asked to write ourselves a letter on what our objectives, on what we really want to concentrate upon, what we're personally going to bring to the Health and Wellbeing Board for next year. And that arrived last week. I don't know if everybody else got theirs. And I forgot to bring it today, but a paraphrase to say that get done what you say you're going to get done was essentially what I'd written to myself, and I think that was the theme, wasn't it, of some of our conversations. So that's a challenge we have to keep holding up to ourselves. The second thing I was going to say was, yes, it was a good session, and we need to, in our very busy working lives, ensure that we still have that reflection piece. So I would be looking for something similar, later on the year to make sure that we still can do that.
Okay, anybody else who wants to make any comment on the developmental session? No? Okay, well, thank you very much for that, Rachel. Again, formal recognition and thanks go to Steve Bedser. And obviously, from our perspective as an Health and Wellbeing Board, in terms of the action plan and the move forward for us, is that agreed that we accept that? Yeah? Okay. Thank you very much. We'll now move on to item number 9, which is the Health and Wellbeing Board Forward Plan. And I'd like to invite Claire Henry to sort of present this.
So I suppose it's just following on from the item on the development plan. So this is some pragmatic stuff. So we discussed a lot at the December session. So I thought I'd put that into some forward plan for 2025. So what we're thinking about wanting to do going forward. Councillor Smith has already preempted me. So one of the things that we discussed was the proposal for the Health and Wellbeing Board to go on tour for 2025. And to go out into either community locations, or it could be other organisational locations as well, venues. And one of the thoughts that I had was that we would try and theme that and link that to the areas of focus that we've got. So they are not started to be looked at yet. So myself, Simon and Claire Hewitt have got the job to look at that. But if anybody's got any recommendations where we can fit all of us in there and some residents in the community linked to our 3 areas of focus, then please let me know and we'll start planning that. My thoughts are to start that in June of this year for the first area of focus update or spotlight. Again, I've preempted Councillor Ball in terms Anthony in terms of reflection, so considering maybe having 2 development sessions, so we have a summer and a winter development session. Don't know what we'll do with those, but that'll be around reflection, looking back, maybe shining a light on what we've been doing and what we want to do next, just to give ourselves a little bit of time to work out whether or not we're progressing in the way that we want to. The other pragmatic things I've got to do is look at the terms of reference. So we want to look at the terms of reference for the board. We've done a lot of changes over the last 12 to 18 months, and we want to make sure that they're updated and are fit for purpose. So they get approved at the annual council in May. So my proposal is that I will do a review and then we will circulate those, Chair, if that's okay, for comment and bring them back in March to the board for sign-off before they go to annual council in May, if that's okay. And alongside that, we'll look at the membership list as well and make sure that I've got everybody's titles correct, that we've got everybody's representation that we want, and also it'll give us the opportunity to review who we've got in the room and who we may think is missing as well. So that's in terms of those. Let me just look in terms of a... So that's what it looks like at the moment. So we're here at the moment, January. In March, we've got the opportunity for Gavin Boyle from the ICP to come and talk to us around some work and looking possibly at the Joint Forward Plan refresh. So we might want to think about that and have some thoughts on what we would like to either present to Gavin or what we would like Gavin to present to us, and those terms of reference and membership approval. And I'm suggesting that the second half of the board is, again, another development item, and then we'll look at round sponsors and the work towards the 3 areas of focus. And that's what we'll be doing after this session today. We'll be having that time for the sponsors to have that discussion, and then we can work out what we want to do with the March board as well. In terms of June, we have to appoint the Vice Chair again. We'll have the Health and Wellbeing Annual Report coming back, so we'll be looking at what we want in that. And then potentially is our first spotlight. So these are, again, all proposals, but the spotlight on the first area of focus, which is improve the experience of aging, and that's where we'll do our first day trip, if that's okay. And then we'll look around July to put a summer development session in. And then P&A is due back in September with another spotlight, the final spotlight in November, a winter development session, and then we go through to 2026 around evaluation and progress of the board potentially. We might want to look at that. And then, again, the draft annual report. So that is the proposal for now. Obviously, things will come in that we might want to have come to the Health and Wellbeing Board that we might want to invite, and also things that might be circulated to members by email as well. So not everything has to come to the board. But I'll stop there for any comments from Chair or Health and Wellbeing Board members.
No. Thank you, Claire. Can you just flip back to those 4 recommendations? So in terms of forward plan, obviously where that's concerned, I mean, has anybody got any comments or queries they want to raise? Phil?
Just wanted to clarify, so you said that Gavin was coming from the ICP. Is he not coming from the Integrated Care Board? Because is that, or is he coming from the Integrated Care Partnership?
So I've been told it's coming from the ICP, but I can clarify that. So Mariana Hargreaves has asked for him to come to the board and to look at the linkages between the Health and Wellbeing Board and the Health and the ICP strategy.
Okay. So in terms of, obviously, that forward plan, is there any other comments that anybody wants to raise on that? I mean, it's a bit of a plan on a page, Nabil, and then I'll come to you, Vanessa.
Yeah, I just think it feels a bit of a no-brainer to do the women and children's one in one of our schools in a deprived area. Just be at the start of the school term as well.
So there's a start for 10 for you, Claire. All right. Vanessa?
I love the idea of Health and Wellbeing Board on tour, and just to remind the board that actually we've got a lot of really small grassroots organisations in the borough that are really would welcome having a conversation. We've got lots of constituted group, non-constituted groups, those really granular that are actually the backbone of our communities and our community cohesion, and Doncaster would really help facilitate some of those conversations.
Can I suggest, not to make it overly complicated, but one of the things that we did to get Doncaster moving is we've sort of like done a bit of a tour with that as well, which has been really successful. And what we've done is we've gone into certain areas, certain wards, certain localities, and we've asked all the localised group to do a bit of a showcasing session. So we could break it down to make it more interesting, and we could say to groups, you know, come along for the day, meet the Health and Wellbeing Board, and, you know, what they tend to do is, you know, they'll come with the stands and the leaflets, and you can have a chat and a coffee and a biscuit and have that discussion. I just think that it gives us an opportunity, rather than going into a static meeting, to sort of like meet and greet some of those really important groups like Vanessa sort of like put forward in those areas. Sarah.
Thanks, Chair. Yeah, I agree with that point as well, Chair. I think that'll be much more rewarding for everybody and useful. And I was just wondering if we could build into the terms of reference or the work plan, like how we're going to be documenting this and sharing our journey and our work, and sharing people's stories so that it feels quite alive. Because when you Google Doncaster Health and Wellbeing Board, it's not the most inspirational, is it? So it'd be brilliant to kind of work on that, because I think if just, you know, building an excitement about it as well, and getting the word out there that it's coming out so people can come and join us as well.
Well, I think you're doing us a disservice saying that we're not inspirational, Sarah, to be honest with you, but there you go. But I think that does make sense to do that, you know. Did you want to come back, Rachel?
Yeah, so we've had a Health and Wellbeing Board annual report for some years now. We're not required to produce one. It was one that we've done, I think, for about 3 years now. It's been a kind of summary of everything that's been done, and I think you're right. We could do with zhuzhing it up and making it a bit more funky. Oh, good, Claire's nodding at my funky. So yeah, again, as we're working, growing, developing together as well. I'm not very creative, but I know that we've got some creative people, very creative people as part of our membership as well. So more than happy to dip our toe in the water of a more beautiful, creative, interesting, interactive version of, might be a report, it might not be, of how we report on the work of the Health and Wellbeing Board, and then have a real go for it after the end of this year as well, I think.
I always use the example of a Mrs. Brown that potentially lives in a bungalow in Denby that she hears about these things. She's got no idea how they run and what they do. And I just think actually that piece of paper there, that report, what relevance has that got to that person? When they pick that up and they read it, it's like, well, not about understanding, it's about, well, actually, does it turn me off within 30 seconds? Or is it something that actually, I can relate to that. That's what they've done, and I think that's the measure, isn't it, to a large extent. Sarah.
Yeah, I was just thinking out aloud as well here, because we know we have to wait for the year for the report, for all that information in its capacity at the moment. So to be able to share the journey, I think is really important, and being able, like, if you kind of have a place where people can kind of catch up, especially if you're going to go on tour, just to emphasize that would be really helpful. And then you can build in all the work that's going on and the different people that represents different boards that people can see or attend, like if you think about darts and the stuff that they do and things like that. It's just a good way to be able to then start to really integrate and get that action, I suppose, as well, a bit more. Thank you.
I'm just going to come to that lady at the back. I'm sorry, I haven't got your name.
Thank you. My name is Dolly. All right. I just wanted to contribute to what Sarah said and what Leslie said as well, and to bring into perspective some of the points that Mr. Tim Brown raised before he left. And I think that's where we are now, about trying to measure the impact and focus on what has worked and what we are still struggling with, to be kind of open about it, and then the journey so far, because anybody coming to try to find out may not have access to all the informations. So if we start from where the journey started, the little strides that we have made, and be very open about what we're struggling with, especially the emerging priorities as we're moving forward, and then strategically plan to say, this is what we aim to achieve in the next coming year. So those kind of things will bring to light the progress that we've made. But if everything is still scattered, we're here and there, it may be difficult for someone like Mr. Brown or anybody from ethnic minority to try to look to say, okay, hang on, these are my needs here. We're not where we used to be. We've made a lot of progress, but we need to measure it and let the public know, as well as engaging our different minorities as well. Thank you.
That's a really good point, because I think, we're almost moving to a situation where we, it's almost like you said we did, but we need to measure that journey. And I think you're right, Dolly, that needs to come forward as well. Rachel.
Yeah, just a reflection as you were talking, Dolly, as well. So I think we're saying we need a way that we report what we're doing, progress, what we've achieved. Just, again, thinking about some of the things that we already have in place and how we either join them together or ensure that they're fulfilling separate purposes. So I have a DPH annual report that's published each year usually on a focused topic. I know Doncaster as well publish an annual report as well. So just some thought and homework for us and Health and Wellbeing Board Secretariat, take all these comments that we've heard today and think, actually, what might our product be, and come back to you and say, test and try some different versions, because what I don't want to have is 3 or 4 different annual reports, reflective reports. So there might be a different way that we do that reporting, but more interactive, more maybe web focused. So thanks.
Okay, so thanks for that. There's nobody else indicating that they want to speak. So just in terms of item 9 that Claire's very kindly brought forward, are we happy with the forward plan agreed? Is that agreed? Yeah? Okay. Thank you. That's fantastic. We will now move on to item 10, which is the action plan for improving the health of minority communities in Doncaster. And Victor's going to present this. So there you go, Victor. It's over to you.
Thank you, Chair. Just testing the system works. Yes, I think it's work. Thank you, everybody. I'm going to walk you through the action plan for addressing the minority health in Doncaster. This is basically meaning what would be referred to as, in other terminology-wise, Black and minority ethnic communities, or Black Asian and minority ethnic communities. So there are different terminologies. As I said earlier in response to previous question, this is a terminology that when we formed the group together, it was felt to be a more inclusive terminology, and hence we've used it. So the reason why this came about is twofold. One was also a recommendation from previous Health and Wellbeing Board that we needed, when we presented progress report, was we need a smart action plan. And I think some of the things we talked about, being able to evidence achievement, the action plan need to be smart, that is specific, measurable, achievable, and so forth. So a key thing really is we want to be able to capture outcomes as the plan is being implemented. It's going to be live action plan. And then the second part of the why we need this one is obviously we have refreshed our our health need assessment, and one of the recommendations particularly emphasized that we need to have a smart action plan. So those are the two reasons. The presentation I'm going to give you, key highlight is the purpose, why we need the action plan, the process, how we developed it. It's important to kind of recap that, particularly around addressing the questions around inclusivity. And then I'll walk you through the key points of the action plans in terms of the contents. And then I'll try to make link with the health and well-being 3 priorities, that is women's health, women and child health, improving the experience of aging, and then creating healthy places to live, grow, and play. Similarly, the linkage with fairness and commission recommendation. I remember when the report was out, we were sent to comment on it and also to see how we can contribute to it. And I think the action plan contributes to both the Health and Wellbeing Board priorities as well as the Fairness Commission recommendations. So as I kind of alluded to, it is to develop, the action plan is to develop a smart action plan so that we can be able to address the health needs of our minority population in Doncaster. It's one of the key recommendations from the Health Need Assessment in 2013. There were a few other recommendations. If you're interested, you can have a look at that. And also, it is also one of the recommendations from our previous Health and Wellbeing Board last year that we need a smart action plan. And this is also building on the past 5 years, what we have done based on the health need assessment we did in 2018. Some of the themes still remain the same. It's not meaning that the problem has gone away, but we made progress. And we have been proactive in adapting to the emerging challenges such as COVID, which was really helpful. So the process of developing the action plan, we wanted to make sure that there is ownership by the stakeholders. And that is really very important. In order to do that, we held 2 workshops, bringing together various stakeholders. I know some of the people who were taking part in the community consultation are in the room, some are not in the room. Natasha, for example, she did a lot of work engaging with various other communities. We wanted to get some of them to be part of the workshop, as well as a list of a number of stakeholders who took part. We had 2 sessions. One is quite a larger, probably about, I would say, nearly 30 stakeholders, partners in Doncaster. And this was, we produced a template of the action plan. The purpose was we wanted to see who owns which bits of the actions. We need to make that. Otherwise, if a few of us sat together and then say, well, so-and-so will do this without them being engaged, it wouldn't be fair. And then we refined that further because that initial workshop wasn't enough. We refined with more focused stakeholders who are the strategic leads to firm up the action plan. And the other last bit was the steering group, which is about half a dozen of us from both NHS and Leisure and the council. We were able to bring all those together. And then where we needed some tidying up, we liaise directly with individuals who we think are critical in order to either because they were not present in the meeting, or we want to have a follow-up discussion with them. And then we finalized the action plan in December. So I'm just going to take you briefly through the key actions, content of the action plan. One theme is around leadership and workforce. So one of the key things there was we felt we needed to bring it to the Health and Wellbeing Board here to get the endorsement of where we are, or at least get a comment so that we can take back and then progress with it. And then there are resource implications to some of this action plan. We are realistic that we are living in a resource-constrained situation, But what can we do? Because the resources can be ourselves, our existing human resource. How can we creatively make use of that? So thanks to Rachel, has agreed to kind of fund a post for us, public health improvement coordinator, which would help have dedicated time to lead on this coordinating part of this work. It doesn't take away the various agencies who will be leading on it, but you need a person to coordinate on that. And a process is in place to recruit to that position. And that's really helpful. And the other one is the terms of reference. We'll be kind of reviewing the terms of reference since we develop it to ensure that it's inclusive of the membership. What happened is over time, some people do drop out. So we are conscious about that. So we're going to look at the terms of reference, refresh it, and then recruit to more members in order to ensure that there's a two-way communication between what we do and then the constituencies. And also we'll look at understand what are the gaps in resources to be able to effectively engage with the community. The second action plan theme is around access to healthcare, and this is a big one. Part of these challenges really is ongoing, but progress is being made, and I'm sure some of you around the table acknowledge some of this ongoing one: access to GP services, dentists, hospital, mental and community health services. I say this is likely to continue to be an ongoing one, but we'll document the progress that we're going to make and the challenges as well. We agreed to have lead persons. You can see those are different streams there. We agree also to have a plan with a view to engage with different groups as part of implementing Core 20+5 program. So for those who may not know, Core 20+5 is basically a program to be able to address inequality, identifying the 20% most deprived part of the population, and also identify some key areas, for example, things like smoking, for example, mental health, or some excluded group like gypsy and traveler. So it is really around that. And also improving awareness and access to community mental health hubs is another one. Early intervention and prevention is key. We have Thrive, which is kind of now embedded. So how we can link into that model so that people from minority communities are part of that process. Third one is access to adult social care. We heard about stories of, for example, Chinese elderly people, including some with dementia. They say that if they need to put the older person into a care home, they will have to go to Manchester or Swansea in Wales. So there's a question there around the cultural context of some of this community where they come from. It's not that they don't put their people in care homes, but I think some of them feel that it's a failure if they put their loved one in a care home. So there's a bit of understanding in terms of the culture of some of these minority groups. The broad principles still remain the same with the wider population to keep their older people at home as long as possible. And I think we need to extend how we understand that for minority groups and support them in that same agenda. And then we have a theme around translation interpretation service. It's different in NHS and social care, but sometimes it's being used. So it is really about understanding the key language we have in Doncaster, access to them so that people who needed to access services are supported to be able to access this service. And I think that's the main one I want to highlight. And then you will see also bean has been raised up, and again, this is the beauty of speaking with communities. Blue beans, the message was that they don't know what goes in and out, and sometimes when they are collected, they seem to be very simple. So we had conversation with colleagues in the place who leads on this. They've done some kind of videos, which is really helpful. So the idea is, how can that message be cascaded broader? Or are there other ways how to communicate to our residents the blue beans, what goes in and out, and when they are collected? So it is really about communication, finding some innovative way of communicating to people, because if we put those labels in English, some people may not understand it. And then we have theme around data. This is important because we need to evidence our progress, but also we can use that information to understand need. We really have challenges. Well, we do have some challenge. We have data. Some of those data are in our respective organizations and systems, but they are not being used to report on service outcomes and uptake as well. So there's some work that we need to do to kind of see how we can use the data that we've got to tell a story. I think it's not asking, let's collect what is not there. People would say there's a lot of work, but we know that there are, as part of our organization, respective organization, there are information already available. The challenge is, how can we share some of those information to tell a story by our population profile? For some reason, some population are small. It's understandable, but it's using what we've got. And then we have building communities and creating opportunities. So this is really important. Community groups all wanted to kind of engage with what's happening locally. The excellent work our colleagues, Doncaster, led by Vanessa, is going to pick up this theme in terms of helping to engage with various community, including minority groups, so that we co-produce actions with community together. You will know that in the plan, the details is not there, but we do have underlying detail of some of those work, and that will be developed again as part of the implementation with the help of the Health Improvement Coordinator, who will be leading this piece of work, and the Doncaster team as well. And it will fit into the thriving voluntary sector in Doncaster. And so, just to conclude, how this links with Health and Wellbeing Board. So if we take the women's and child health, access to health service is important. And we have also the work around Core 20+5 that helps to address the health of women and children. Particularly here, we talk about vaccination, for example, an area that I've been working on. We find quite uptake of vaccination broadly is reasonable, but we could do more, particularly when we are being faced with challenges of outbreaks, things like measles. We need to make sure that those uptake is high. But when we want to find out what the uptake is among some of the population group, A, the data is not there to help us to tell that story. And B, we know that the uptake is fairly quite low from what people tell us from their feedback. Also aging as well. So we talk about older people to stay as long as possible at home. That will address that. And then the issue of mental health, access to health services, another one. Creating healthy places, the theme around building community and opportunities, and then access to health services can help contribute to that agenda. And if we look at the right-hand side in terms of fairness commission recommendation, we have, I think, a number of those things, building sustainable community, opportunity for employment, to ensure that everyone is involved and fairness and inclusive. Reducing health inequality is key part of that strand. And link with the agenda around kindness and compassion in service delivery. So I think you may have questions, comment, but I'm happy to take any questions and comment.
Yeah, thanks for that, Victor. If you've got any information in terms of what not and what to put in your blue bin, I'd be really thankful, because even I get confused with that. No, but thanks for seriously. Thank you very much for that. Just a couple of things from me before I open it up to the rest of the board. I think it's fair to say one of the main tools that you're going to need in terms of that measuring of progress is that dashboard and that data to be able to go into that. And it's about how I suppose you pull that together, because it's that journey, like Dolly's identified, but also Mr. Brown, in terms of where we were at and where we're at now and where we're wanting to go. And it's that there's nothing more pressing at this point than that measure of progress in terms of how are we doing, because it may well be that, we know we've got obviously an action plan there, but that measure sooner or later is going to have to be applied to it, really. Again, another thing from me is I think one of the key aspects, and I'm really pleased to see that there's a bit of work being done around translation services, because one of the key aspects really is around the amount of information, advice and guidance that's out there, so that people can access services and where they can access services and by whom. So that to me is key as well. So I think that's very, very welcome, really. So I'll just open it up now to the rest of the board. Anthony.
Yeah, thanks, Victor. And it's a really comprehensive piece of work. It was good to see. I like how it's linked to what we've decided as a Health and Wellbeing Board are our priorities, and clearly the links to the Fairness and Wellbeing Commission, that we were all anxious, weren't we? That wasn't just a very good piece of work that then sits on a shelf. So I think the linkages there are very important. Couple of points that I wanted to make. The first is the challenge from Mr. Brown, that we just said that this is rooted in user experience, and we're able to have that evaluation, qualitative conversation with our users to make sure that it's not just us that think that this is a good idea, but it's actually reflective of what our public think. So the challenge all along to make sure that we do that. And then the second point is the broad church of access, which is a very, very broad church, obviously, when you see it written down like that. We had a chat, didn't we, Glynis, before the meeting. For me, it's about appropriate access, and that's what we've got to challenge ourselves on when looking at our measures of success. And the communication piece, which I think you were hinting at there, Chair, with our public about what is appropriate access, what is right access, what is right expectation of access, and that's a difficult conversation sometimes, but I think we need to commit to have.
Thanks for that, Anthony. Anybody else? I've got a few up here, so I'll work through it. James, do you want to come in?
Yeah, it's a really great action plan. It was more of an offer to support you with it, really. We recognise, it's well recognised that advice improves lives, and we've got some really great projects locally that measure that and can show some statistical improvements in that field. And also last year we did some research with Sheffield University about what barriers there are for minority groups to access services, little in a local perspective. So I'd love to share that with you and see if that can help shape the building accessible community spaces.
Okay, thanks for that. Nabil, I'll come to you next. I've got you, Glynis. I've got you, Phil. Go on, Nabil.
Yeah, thanks. A few thoughts from me. So I think it's helpful this coming on the back of Mr. Brown's questions and really valid points raised earlier. So I'm just thinking that we've got a lot of timelines on this that are for March 2026. So coming back in 14 months, this document is the multi-agency plan for improving minority health in Doncaster. Are those themes the things that are really the top ones for what we want to be able to say we've done in 14 months' time? So I guess the one that stood out to me was about the blue bins. So that's not really around minorities' health. I wouldn't want that as part, one of our top 7 things for that. So that's an action that needs doing, but not as part of this unless it ties into it in a way I haven't thought about. And then really sort of delving into some of those timescales. So there's some things in there where you've got March 2026 to improve access to services, so more timely access to planned healthcare, improved health outcomes as well. So again, it'll be very easy to come back. We're not going to really have made a huge difference on that. So I think we need those SMART objectives, that are things that long term will improve, that we can do by this March. There's some objectives there by next March. So I think it's a really good starter, but it probably needs if we come back in 12 months, what can we realistically have done and what sets us on to that better path for the future?
Smart and fine tuning. Do you want to come back on this, Rachel, or just on that one there?
Yeah, so I think the blue bins was a strange one to see, but just thinking about the methodology that we've got to come to the action plan, and I guess what it might suggest is other ways that we communicate information and the languages that we don't use. It's an indicator of that. So actually, if blue bins was what people were talking about, actually, how do our winter wellness type messages land or not? So again, just to flesh that one out as well. Yeah, absolutely. Around we're probably not going to solve access in the period of time that we've got, but what are the things that we can do? So things that we know that other places are doing around actually how do you know who's on your waiting list, and what kind of tools or data intelligence do you need to sort that, and how do we have or maintain that equity lens on various decisions that will have to be made around health services as well. So we're not saying something needs to change and making that change without truly understanding the impact, whether it's somebody's ethnic minority background or something else that makes them more vulnerable to a poorer health outcome. So yeah, just on those two bits, I think it's recognising, accepting and understanding the action plan that's been developed with representatives and people from across Team Doncaster and refined in that way as well, and from voice and commentary from our communities. So how do we use that through the other things that we do as well? So how does the action plan exist alongside people who then go back to what their other job is, or their second job is, as well as being members of the Minority Partnership Board? So I think there's some refining still to do about how does it look, how does it action, how does it work, and how does everybody know and agree that the things that we've said here are things that we can really tackle through how we're already working, but also some of the challenges that will exist as well.
Okay, Glynis.
I did have one thought. We all have a piece of paper put through our letterbox that says what we put in our bins. And by and large, that's the one piece of paper that actually survives from the front door to the bin that I know about. And I tend to put it with blue tack inside one of my kitchen cupboards, and I wondered if we couldn't utilise that very important piece of paper with some information around health, because it's the one piece of paper that I look at very carefully on occasions. And the other thing, as I age personally, I've become very conscious of some of the invites for health appointments and for vaccinations. And I promise you, I'm not going to say easy read, because I don't think that's a useful terminology sometimes. But I do think we could make things much easier to understand. And if I struggle a little bit sometimes, what I imagine is my next door neighbour who is in his 90s, and how he manages to do some of these things. And the other thing I have wondered about this year, because I've been invited for many of these things, all of which I've had, however, it seemed to be a later invite this year, and we do seem to have had very high figures on some of the infections. So I'm wondering whether our figures will show this later in the year.
Just before I come to you, Phil, I think it's a really relevant point you've made there, particularly around the bin calendar, because the bin calendar is on my fridge. Still don't understand the blue bin. I'm not sure whether you can put a yoghurt pot in or a ready meal thing. But anyway, you know, besides the point. But the bin calendar is really useful, and it's there that you put up there. And this is probably an action for you, Dan, as well, to take this away, because I know that this goes out periodically in terms of the year. And you're just thinking to yourself, well, actually, in terms of council, NHS, partner information, why are we not using this more, and why are we not potentially so, and actually we're going to add this to it as well, you know, and I think we should be doing that. So maybe that's something you need to look at, Dan. And again, when you look at that, and you look at that instant information that's going out to residents across Doncaster, you've got Houseproud there as well that goes out to all our tenants. And I'm sure that, you know, Chris would be quite happy to sort of like get information on that out, you know, as much as possible. Because it is about, you know, the more information, the better. And if that's working with partners to get that information out there, that's what we should be doing. So I agree with you totally. Phil, I'm just going to bring you in now, because I know you indicated.
Yeah, thank you. I agree with what Nabil said about blue bins. It would be good to have a justification for why there's a health and wellbeing reason for them to be on the report. It has opened up a really helpful conversation about how trusted sources of information for residents and how health and wellbeing messages could be connected to those. But I'm not seeing here's how better messaging around blue bins will support the health and wellbeing of residents, other than it's something maybe some people would worry about. But, you know, so I can't get my head around that. A couple of suggestions. So again, kind of following up on Nabil's kind of helpful challenge around kind of clarity and accountability. So Nabil's talked a bit about timelines and what's in scope. I just want to talk about names on the plan. So we've got some names on the left-hand side of the plan who are the coordinators. I'm not sure whether they're always people who actually are able to influence the activity. So if I look at my area, adult social care, I see the coordinator's Amanda, who's brilliant around health inequalities, and I see another coordinator who's the carers project lead. I'm not sure that those two people are going to influence access to adult social care services, so we might want to think about, for each of the rows, who's the leads that are actually going to influence this, so that if Mr. Brown comes back to a future meeting, we can say we've got the oomph behind the actions that will make changes happen. And I'd also suggest that where on that third column, sometimes we've got people's names as leads, and other times we've got organisations as leads. And when we've got massive organisations and we've just got the organisation listed, it doesn't help us understand who's holding the ring for that in the Health and Wellbeing Board. And I would have thought Health and Wellbeing Board members, say if it was the hospital, and it said DBTH, I'd probably want, if I was the hospital lead on the Health and Wellbeing Board, to understand who my lead was in that space, or to be challenged if there wasn't a clear lead in that space. I haven't picked the hospital out for any particular reason. It could apply to any of us. And then the last thing I'd say is, it was good to see the connection with all the work, with all the other strategic pieces of work. I think it would be useful, Victor, if the leads for each of the themes met with you so we can properly understand the connections and make sure we're properly doing something about it, because otherwise there's a little bit of a risk of ships passing in the night and we won't actually do justice to the analysis that there's probably been behind this work.
Go on, Peter, do you want to respond?
Yeah, good point. We actually had underneath this a version which has got the representatives, people who came to the workshop. So I think, yeah, good point. Outside, that's why we have on the left-hand side, the key coordinator would be able to liaise with the relevant people on that list. So I think, yeah, we're going to have names to those names in the middle there to be able to coordinate it. The comment around the bin, this is the challenge with the process. when we did the first one, if we had asked what is your what are the things you are concerned about, say if we say health, people would straight away think about hospital or GPs. But if we ask what's the issue of concern to you, and then open it up, because we do know that some of the things are we refer to as the wider determinants of health, directly or indirectly, they do impact people's health. And we didn't want to throw it away, but I think we include it there. But open to views, and Dan, I can say Dan has raised his hand there. Welcome his thought whether he thinks we should keep it or we should take it out.
I think there was just some intimation around you straightening into your mic before you caused feedback, Victor. That's all it was. They were just worried about you causing feedback. That's all, because your mic. It was just a bit towards you. Go on, Dan.
So I think the blue bins is quite interesting because I don't want to kind of get into the history of it, but there was a wider issue about understanding of what could go into the bins, and I think that would be amplified or magnified if English wasn't your first language. So that traditionally with recycling, and I'm reverting to type here, but indulge me, allow me to indulge, you would anticipate that a margarine tub could go in the same one as other plastics. But sadly, the contract that we set up originally with Suez didn't facilitate that. And then what that included in it would be a penalty for contamination. And that's not uncommon in contracts. So just indulge me, because I'm coming around to the wider benefits of this. And this is why I think it's important to understand it and perhaps keep it in, or perhaps keep it in a slightly different way about waste. Because what waste is indicative usually of is lifestyle. It's not uncommon. It's not uncommon. And you see the impact of COVID and waste increasing because more people were at home. We had to sort that out with Suez. So what that meant is that Suez were very keen to us to make sure that people put the right things in the right bins. But I think, going back to what I said earlier about confusion about what could go in, legitimately confused things. So that's been addressed. So now it'll be much more simple that a margarine tub can go in as the same as any other plastics. But I do think what Victor's identified and having it in as an action is useful. Because let's not forget, if the bin was presented and contaminated, it wasn't collected. Yeah? Then what you have is a backlog. Then what you have is them out permanently. And if we think about health and well-being as a place, bins strewn on a street, not collected, frustrated residents, isn't conducive as a positive place to be. Yeah? So I think there's a slightly wider piece to think about in relation to waste. And if you look at some of the work that's been done in Hexthorpe recently, in terms of bin presentations, bin being left out, waste generation, waste collection, some positive moves, and I think that's demonstrating that education and engagement is working. What I would say is, let's not forget that areas that produce high volumes of waste, rightly or wrongly, can be linked to areas of deprivation, and I think there's a need to consider the lifestyles of the people within the houses that generate the lives. So that generate the waste, because I, as an enforcement agent or as a collector, can deal with it solely in that respect. We don't. We try to join up. We try to join up much better, and I think that's demonstrated by the work that's been done in Hexthorpe with enforcement, with communications, with communities colleagues, with public health colleagues. But I do think there's a wider piece about lifestyles and how that generates waste and that impact. Because obviously, if people are eating more fast food, ready meals, whatever, they're more likely to be putting that into a bin and generate more waste. And then also you've got the issue of there'll be more people in the houses generating more waste, which is one of the challenges in Hexthorpe, which, to be honest, shared ownership is and this goes back to another challenge we face within the Place Directorate, is that people can't afford private rented sector now because the local housing allowance isn't enough. We haven't got enough council houses to put them in because we can't build them fast enough to meet that demand. And then the challenge is that they might end up in houses of multiple occupation, which, to be honest, aren't always the best place for somebody to live.
I think it's a really strong point made, particularly with the blue bin as well, because I mean, as we know, if on the face of it, you think actually is that relevant? But then when you look at it, you think, well, if it is becoming overfill and people are using the black bin with stuff that should be going in the blue bin, potentially there's a fine, or the dumping stuff, there's a fine there that further compacts on that person in terms of obviously the stress and I didn't understand it, but I've now got a fine, I've got to pay, and this, that, and the other. So from a wider, because you use the term wider, from a wider determinants perspective, I think it is probably something that is rooted in there. So I do take that and I value it. Rachel, I know you wanted to come back.
Yeah, just providing a chance really for Health and Wellbeing Board members to consider our recommendation for against the action plan for today, which is around endorsing the action plan for improving the health of minority population people in Doncaster. So I think what we've managed to do through the presentation today is have a discussion of what we've seen on the action plan and made some suggestions. So I'm wondering if our thoughts today, thinking about the commitments we've made of how we work as a Health and Wellbeing Board, are around endorsing it with some caveats and some support, recognising as well that we really need to ensure that the methodology that's been taken to develop the action plan has been with communities, has been through the Minority Partnership Board, so not wanting to lose the voice, so maintaining that authenticity through there. There might be, and it sounds like there are different lessons that we can learn about how we communicate with populations, whether it's the translation elements, cultural elements, wider determinants type elements. But I'm just wondering if the action plan that we've got today, whether we want to, as a Health and Wellbeing Board, offer that additional support, layer of support around some of the detail within that as well, and either suggest or support some of the elements of the action plan that might sit better, feel better in other areas, obviously maintaining that link to us in Health and Wellbeing Board as well. So just checking, a couple of nods and a couple of hands as well, so it can be by discussion. Reflecting on what we've been asked around endorsing the action plan, I think we're saying with some caveats or additional support as well.
Yeah, I've just got Dolly. Dolly wants to come back.
Thank you very much, Chair. I just wanted to mention on the health needs assessment as well, as it affects minority families. And going through Dr. Joseph's action plan, indeed, that is very well detailed, but I've got a bit of concerns, and I share with what Phil just mentioned about how do we tackle this action plan. For example, I'll give an example. If you look at some of the inequalities that people from ethnic minorities experience, it just blew my mind from some of the things that we've said today, from somebody, their youth struggling to get apprenticeship or, getting their foot, to inequalities experienced about unfair stuff around our workforce, and such person growing old and becomes elderly and needs care, and there's still no cultural adapted food. Dr. Joseph, you mentioned about the Chinese community, the Roma community, and I heard of like Black and Caribbean, African communities as well. You wouldn't see families put their elderly in the care home because that's their home. It's different from being in the hospital for 3 days and you can cope with the food. But this is your home and you've grown in your home for 60, 70 years, eating foods that are culturally adapted, and some for like the Muslim community, religious adaptation to their food, and putting such person. So I feel if you look at that spectrum, it's kind of unfair, some of the things that some people have experienced, and if we don't look into tackling them, and as we're speaking, I was thinking about other local authorities, perhaps we could try to find out how they meet all these needs as well, and try to work with other stakeholders, and like what Phil said, itemize and highlight in the action plan so that we won't have people coming, and these agendas keep coming because it looks like we're glossing around them. They are being identified, we're working towards them, but we need to actually knock it on the head and try to smash it once and for all to say, this, our elderly, these are the things that we have done, and should they be in the care home, their needs will be met because we've liaised with this kind of organizations that could bring food. For example, during COVID, few communities could not access ready-made food, the elderly, even from their home, because we lost an elderly woman. But I remember that time we were trying to support her, and she said, even because she's African, for example, the food that the Caribbeans bought for her, she couldn't eat it because it wasn't for her. So she would collect it from the door, put it at the door, but she wasn't eating it. Do you understand? So there are several issues that we really need to look into as we progress. Thank you very much.
Extremely valid comments, Donny. I totally agree with you. There needs to be that measure there from what we've done and where we're at now with it. Nabil, do you want to come in?
Yeah, I agree with how Rachel summed it up. I guess the difference I'd say is that I think I'm happy to endorse the concept of having the plan, recognise it's important in the work that's gone into getting to where it is. I'd want to see that version come back before, rather than endorse it with caveats, because I think it's so important to get it right.
Victor, are you quite happy to do that?
Yes, happy to take that, and we can build the changes there and bring it back at a future next meeting. If okay.
I'm happy with that if my colleagues are happy with that to happen, because I think that does make sense, because I don't want to delay it for a lengthy time. And I take on board what Nabil said about caveats and using another term, amendments. But I think that in its position as it is now, I think it's a really strong, worthwhile document, don't get me wrong. And I really like the idea in terms of IAG and obviously the communication and obviously everything that I've sort of like identified. And also the dashboard and RAM data, because I think that's going to be important to get that measuring. But I think that it's been a really worthwhile debate. There's been some ideas thrown about, and it's probably just worthwhile to step back a bit, do a bit of reflection, and then come forward again. Is everybody happy with that? So is everybody okay with that? Is that agreed? Phil?
I mean, I suppose I'd probably personally support Rachel's position as I understood it, which is to approve the report that's come today, because we had the blue bins discussion and actually the final position was keep it in. So no one said that anything should come out of the report. And what we said needs to be added is clearer information about who's doing what and when. So it feels like it's just picking up Rachel's point about the people who've given their time, people who've experienced who've given their time on the work. It feels logical to agree the document but subject to the caveats that Rachel described and that we've discussed. I suppose that's just a personal view, Chair.
Anthony?
Yeah, I'd agree with that, because I think it's the mechanics of its implementation that we need to go away and get done, because I agree with Phil on his point. I think particularly around access to healthcare, I want to see more names in the frame of who's doing that and how they're doing it. But that doesn't stop approval of the paper and the direction of travel. So that would be my opinion, that we approve this and we go and get the mechanics done outside of here.
And I've got Nabil again.
Could we at least just reword the blue bin so it covers the more general concepts, rather than we're saying one of the key themes around improving minorities' health is the blue bin? So I get all the thing that underpins it, and that's great, but let's not have it worded like that, please.
So at that point then, with the amendments around the blue bin, I'm guessing that everybody is in agreement that we accept the action plan today. However, there's that reflection that needs to into to broaden it, to lengthen it, to make it a richer document. Is everybody happy with that? Kelly.
Sorry, I just wanted to ask, has it been back to the community, and what did the community think of it? Have they seen this document? Because I think that's the most important thing, is what the people think to it.
We as part of developing, actually, we invited members of the community as part of that workshop I was talking about. So it was not very long. So we brought it here. As part of the implementation, we will be socializing this with the various stakeholders, including the communities. And I suppose as part of the implementation as well, we will be doing this as sharing what the actions planned with the various communities that we'll be engaging with.
So again, I'll move to recommendation on this, that we basically accept the action plan as it's standing with amendments and it being tightened up if everybody's happy with that, yeah? And I don't think there's anything wrong, you know, in fairness, in terms of Victor coming back to another meeting just to go through those. I don't think Victor would mind, would you? No. So is everybody in agreement that we accept that recommendation? Yeah? Okay? Right, thank you very much for that. Okay, so that brings us to the end of the meeting today. The next meeting is on the 13th of March, so it's not that long from now. And it may well be that's something we need to think about in terms of March, Victor, where you could sort of like maybe have 5 or 10 minutes just to go through it, you know, again, if that'd be okay. So yeah, the next meeting is on the 13th of March at 9 AM, it's at Civic. The formal meeting ends now.